Hello, my name is Joan Roberts. I am the manager of the School Health Research Network. At our summer events, we ran a group work session to get your views on how best to organise the survey in order that the health and wellbeing data resulting from it can be as valuable as possible and really represent the voice of your students. I'm going to share these now. It will hopefully help in your planning of the survey. Preparing to succeed. Many of you felt that if others in the school recognised the value of the health and wellbeing data that Shern provides, there would be more buy-in for the time taken on the survey. This being particularly true of the senior leadership team, who have a pivotal role in survey completion. Key uses recognised by you for the data are as a self-evaluation tool around health, as a way of engaging everyone in the health needs of learners, for use in planning and enrichment of the health curriculum, for example in PSE, Welsh Bac, Science, PE and other subjects. And now, of course, in the new curriculum, where one of 4 key purposes is to produce healthy, confident individuals. Shern data has been mentioned in the documentation for the health and wellbeing area of learning experience as a way to ensure that it meets the needs of learners. How do you get these messages across? We have 2 lots of slides in the September pack, one for pupils and one for staff, that can be used as a basis. But inspiration will come from sharing how the data will be used in your school and showing how previous data has been used. Maybe student voice could be valuable here. Those who came to our events will know that we've produced short films on research element in the survey, a very different focus to this. Planning is key. We know that some of this will have been done at the end of the summer term when you registered, but more may be needed for some. You stress the importance of getting survey completion into the school calendar and organising both the use and support of ICT. The September pack should contain everything needed to run the survey. It will pay dividends if you can set aside enough time to go through everything. In your planning, remember there is a lead-in time of 1 to 2 weeks to factor in for engaging the school community, sending letters to parents and showing the research video on data linkage if your school has opted into this. We cannot stress enough that showing this video should be in advance to give students time to think through their decision around this, not in the session when they complete the survey. Any queries on anything, don't stress or worry, just get in touch with Shern. An important driver here is that if you say that your student health and wellbeing report is the voice of your students, then it must be. When students' views on the data are sought in their voice groups or in the curriculum, then they must feel it really does represent their voice. For those who have planned the survey before, you will have considered the options for how best to run it. Some of you are new, so here are some examples from schools. So it could be across subjects that will use the data, such as PSE, PE, Welsh Baccalaureate, IT or Geography. As an activity in a drop-down health and wellbeing day, or in extended form time, it would need to be extended. We know that involving year 12 and 13 can be an issue. So what would work for you? We do know that the data and our research findings can be invaluable for the individual project and other elements of the Welsh Bac. So is that a driver for them to complete the survey in that lesson? I thought I would finish with a quote from the new Estin report, Healthy and Happy, School Impact on Pupil Health and Wellbeing. This mentions good schools ensured that they had high participation rates in the survey across all year groups to maximise the confidence they could have in and the usefulness of the results. Some interesting thoughts came from the events around getting a quality of responses to the survey. You mentioned the importance of the attributes of the staff overseeing the survey completion, being someone who's well informed, prepared, inspiring and respected by pupils. A number of groups considered whether it might be best to have a small team of well-briefed staff to cover all survey completion. We felt it was important to have someone who can set the tone, give consideration to supporting confidentiality, and to allow students to really reflect over their lives. In supporting confidentiality, you stress the importance of the teacher not walking around the classroom unnecessarily. They need to make it very clear to the students that they are not looking at their responses. You had views on setting up the room, maybe ensuring as much privacy as possible, so using laptops and tablets where possible, and maybe putting posters up to signpost to safeguarding staff in the school and to childline number. Many thoughts were on supporting those with additional learning needs. You also gave us ideas that we can consider for the future, but there wasn't time to act on this for this year. In terms of school planning, some students may need longer, so that time needs to be built in for that. One thing that is also possible is that you could allow those who need it 5 minutes or so between questions if they need to have a little break from looking at the screen. Where additional support staff are involved, ensure they know to help read a question, but then turn away so it's clear that they are not reading the response given. Would it suit all young people to complete the survey with their class, or would an alternative setting work? Some pupils might not be doing the survey or finish quickly, so ensure they have another activity to do. Anything else to think through? This may well not be an exhaustive list. We're always keen to hear about what works for you. So, any more help needed? Please do get in touch about any issue, small or large. Here's the email and the phone number. The website has information on how schools are using their data, slides from the events and newsletters, and then, of course, webinar and a research brief to show research evidence for you. We're working in conjunction with Healthy Schools, so you can contact your local team for support as well. Thank you in advance for all of your help. All the very best.